Hello everyone, welcome to our channel. The NCCN, National Comprehensive Cancer Network, Clinical Practice Guidelines in Oncology for Genetic Familial High-Risk Assessment, versions 3.2026, was released on February 19, 2026. It provides detailed recommendations for assessing cancer risk, planning, screening, and surveillance, and understanding treatment across several types of cancer, including breast, ovarian, pancreatic, and prostate cancer. Today, we will introduce one of the genetic variations that is highly relevant to many people, the BRCA, BRCA gene mutation. A BRCA mutation is harmful changes in either the BRCA1 and BRCA2 genes, which everyone has. These genes play a very important role in the body. They act as what doctors call tumor suppressors. In simple terms, they help repair damaged DNA and keep cells from growing out of control. This repair process is essential for preventing cancer. However, when one of these genes is mutated, this repair system does not work properly. As a result, DNA damage can build up over time, and cells may begin to grow in an uncontrolled way. This greatly increases the lifetime risk of developing certain types of cancer. Both BRCA1 and BRCA2 mutations are linked to higher risks of cancer, ovarian, pancreatic, and prostate cancer. These mutations are passed down in what is called an autosomal dominant pattern. This means that a person only needs to inherit one copy of the mutated genes from either parent to be at increased risk. If a patient carries a BRCA mutation, each child has a 50% chance of inheriting it. Importantly, this mutation does not skip generations. If someone does not carry the mutation, they cannot pass it on to their children. Because of this, genetic testing is often recommended for people with a strong family history of cancer. Identifying a BRCA mutation can help guide more personalized screening and prevention strategies. When we look at cancer risk, both BRCA1 and BRCA2 mutations increase the likelihood of developing cancer, but the exact risks are slightly different between the two. For individuals with a BRCA1 mutation, the lifetime risk of developing breast cancer is estimated to be between 60 and 72%. The risk of ovarian cancer is also high, ranging from 39 to 58%. For those with a BRCA2 mutation, the lifetime risk of breast cancer is slightly lower, at about 55 to 69%. The risk of ovarian cancer is also lower compared to BRCA1, estimated at 13 to 29%. Both mutations are also associated with increased risk of pancreatic cancer and prostate cancer. For pancreatic cancer, the risk is up to 5% for BRCA1 and about 5 to 10% for BRCA2 mutation. For prostate cancer, the risk range from 7 to 26% for BRCA1 mutation and is higher for BRCA2 mutation at about 19 to 61%. Genetic testing play a key role in identifying these mutations. Testing is usually done using a blood or saliva samples. In families where cancer is present, it is often most helpful to test the family member who has already been diagnosed with cancer first. This helps identifying the specific mutation present in the family. It is important to understand that a positive test result does not mean that a person will definitely develop cancer. It simply means that their risk is significantly higher than that of the general population. Especially for women who carry a BRCA mutation, regular breast cancer screening is essential. Clinical breast exams are recommended every 6 to 12 months, starting at age 25. Between age 25 and 29, annually breast MRI with contrast is advised. Mammograms may be used if MRI is not available. From age 30 to 75, both annual mammograms and annual MRI scans are recommended. After age 75, screening decisions are usually personalized based on the individual's overall health. In addition to screening, some women may consider risk-reducing options. Those include preventive surgery, as well as medications, which can lower the risk of developing breast cancer. For ovarian and fallopian tube cancer risk, preventive surgery is a key strategy. For women with a BRCA1 mutation, removal of the ovarians and fallopian tubes is typically recommended between age 35 and 40. For a BRCA2 carrier, this surgery can often be delayed until ages 40 to 45, as ovarian cancer tends to develop later. Long surgery options are also available. For example, oral contraceptive pills have been shown to be significantly reduce the risk of ovarian cancer in patients with BRCA mutations. Hormone replacement therapy, HRT, may also be considered for premenopausal women who undergo ovary removal, as long as they do not have a personal history of breast cancer. For prostate cancer, screening is recommended starting at age 40. Men with the BRCA2 mutation are advised to have annual PSA blood test, while men with the BRCA1 mutation may also consider the annual screening. In some cases, imaging tests such as MRI may be used, especially for those with a strong family history. Pancreatic cancer screening is also considered for certain individuals. For BRCA1 carriers, screening is usually recommended only if there is a family history of pancreatic cancer. For BRCA2 carriers, screening may be recommended regardless of family history. BRCA's mutation status is not only important for risk assessment and prevention, it also has direct implications for treatment. In recent years, a group of medications called PRP inhibitors has become an important option for patients with BRCA-related cancers. This drug works by blocking a protein that cancer cells rely on to repair their DNA. Since BRCA-mutated cancer cells already have difficulty repairing DNA, blocking this pathway causes the cancer cell to die. There are currently 4 PRP inhibitors approved for use in different types of BRCA-related cancer. This include olaparib, talazoparib, niraparib, and ricaparib. These medications are used to treat cancers of the breast, ovary, pancreas, and prostate, depending on the specific situation. It is important to know that not every PRP inhibitor is suitable for every type of cancer. The choice of treatment depends on the patient's diagnosis, stage of disease, and prior treatment. In many cases, a confirmed BRCA mutation is required before these medications can be prescribed. Like all treatments, PRP inhibitors can have side effects. One advantage of these therapies is that they are usually taken by mouth pills or capsules. This makes them more convenient compared to traditional chemotherapy, which often requires intravenous treatment. In conclusion, understanding BRCA mutation is a key part of modern cancer care. If you have questions about BRCA testing, cancer risk, or treatment options, it is important to speak with your doctor or genetic counselor. They can help you understand your individual situation and guide you toward the most appropriate care. That's all for today. If you found this content interesting and helpful, don't forget to give a thumbs up, subscribe, and hit the notification bell. Thanks for watching, and we will see you next time.